Hi, my name is Dr. Raul Sanchez. I'm a pediatrician at Carithers Pediatric Group. Boy, we have been getting so many fantastic questions from all of you about COVID that I thought it would just be really great to do this video and just give you the most updated information from the CDC. But full disclosure, this is an ever-evolving science right now. And so please, despite what I'm telling you today, as of June 28, 2020, even though these are current recommendations, these recommendations might change as time goes on. So please stay current. We will do the best we can at our office to keep you updated with information. We will keep our website updated. And so hopefully you'll always be able to go there for the most recent information. So with that said, I wanted to talk a little bit about what are some current instructions regarding COVID-19. So first, a great question that everybody has is, and everybody's talking about is, how is actually COVID-19 spread? Well, the primary mechanism by which COVID-19 is spread is through respiratory droplets. I love that picture right there, and I chose that picture because I really think it shows how somebody's respiratory droplets can spread. They're produced when an infected person coughs, sneezes, or even talks close to you. Those droplets can then land in your mouth, in your eyes, or in your nose, and those can be thus absorbed or breathed in, and that's how one person can get another person sick. It is also possible that you can contract COVID through touching infected surfaces. And those surfaces can be infected by someone who either has COVID and coughs, sneezes, or speaks onto that surface, or if that person touches themselves in one of those places, gets their own secretions on their hands, and then touches that surface. Currently, there is no evidence that spread from that COVID can be contracted through spread on food or food packaging. So while that was a concern early on, that is much less of a concern now. I think the real focus in this talk is really going to be the respiratory droplet spread, because truly that is the biggest concern in terms of spread of COVID. You'll see the term close contact, and I think it's really important to define what I mean when I say close contact. And so I loved that picture, and I picked that picture because I try to practice social distancing in every situation that I'm in, particularly when I'm out in public. And so what I've learned is often people are not respectful of social distancing in supermarkets. And so I actually use my grocery cart and I strategically position it so I make sure I keep people at least 6 feet away from me when I'm standing in a line. But close contact is considered being within 6 feet of another person. And what we know about COVID is the closer the contact with the person, the higher risk of COVID spread is. Also, the longer that contact period of time is, the higher the risk is. So trying to keep six feet away to avoid that close contact. What should we all be doing right now? When you look at our community and you look at how the CDC defines the spread or the community transmission of COVID, they break it up into mild, moderate transmission, and substantial transmission. Jacksonville can be thought of as a city that has moderate to substantial transmission based upon the rates of spread right now of COVID in the city. So there should be some things that we should all be doing right now. Number one, we should be practicing social distancing, i.e. keeping careful to not have close contact with people. So 6 feet or further away, avoid crowded areas, and certainly in areas where there's people, make sure you maintain that distance. Also, it's important to wash your hands with soap and water. Wash frequently and use hand sanitizer. If you're going to use a hand sanitizer, use a hand sanitizer that has at least 60% alcohol. Those have been known to be safe in terms of being able to kill the coronavirus off of surfaces. Hand sanitize frequently. Obviously, sometimes it's not so convenient to wash your hands when you're out and about or going to the grocery store. But in those situations, keep hand sanitizer on your personage and just sanitize your hands once leaving the store and even going into the store, because there's also something to be said for preventing you from potentially spreading it to somebody else. It's also important to disinfect surfaces that are touched frequently. So an example of that would be like an office phone where multiple people might use. It would be really important to disinfect that phone in between each person's use. Covering the mouth and nose with the mask, because of what we know about that spread from that previous picture that you saw, where those little respiratory droplets can just inject that virus into the air and spread it to other people. It's so important to provide a face coverage. So not only keep that social distancing when you're out in public, but social distancing with a face covering will severely decrease your ability to not only contract the virus from somebody else, but also to spread the virus from somebody else to somebody else should you have it. And cough etiquette is really important. Cough etiquette is what all of our children are learning in school right now. And that is not the old-fashioned way that many of us used to cough into our hands, but what is recommended is cough into your elbow. So that way, if you're avoiding coughing into your hands, because if you cough into your hands and then touch other people, you could be spreading the virus to other people. So you want to just really avoid coughing into your hands. And in reality, what we really should be doing is avoiding touching our eyes, face, mouth when we're in public. And that's the beauty of having a face mask. Is a face mask is a wonderful reminder whenever you try to get that hand up because you got to scratch yourself in the face. A face mask is a wonderful reminder to, hey, stop. I shouldn't be touching my face. I could be spreading virus to myself that I've touched, or I could be infecting my hands and potentially infecting somebody else. And also be alert for COVID-19 symptoms. And what are COVID-19 symptoms? Well, there are some main symptoms, and these are the ones that we have been seeing in the news: fever, cough, and shortness of breath. But now there are other recognized symptoms that are associated with COVID, and these are fatigue, muscle or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, or the stomach symptoms of nausea, vomiting, or diarrhea. These are all considered COVID symptoms, but the main three are the ones that are the most troublesome, the first three. So let's go through a few scenarios, and these are scenarios that we're all hearing about and seeing, and some of us might be in one of these scenarios right now. What do we do? What do I do if my child was exposed to COVID-19? So the recommendation by the CDC is to keep your child home quarantined until 14 days past the last exposure. To check your child's temperature twice daily, so monitoring for fever, and also watch for those COVID-19 symptoms that you see listed. And it's important to keep your child away from people who are at higher risk of getting sick from COVID-19. So what is a higher risk situation? Who is considered high risk? Well, certainly older adults. What we know from this disease is it's not only just older adults, but anybody. Every decade you add on to a person's life, their risk increases. We see most mortality in adults age 65 and older. So for our situation as pediatricians and your situation as parents, that can tend to be the grandparent age. So really being cautious with grandparents. Also, high-risk individuals in the pediatric community would be a child with underlying medical conditions, such as children who are medically complex, that have neurologic disease, genetic diseases, genetic syndromes, or metabolic conditions. Also, children who have congenital heart disease are considered high risk. So some other high-risk situations are chronic kidney disease, COPD, being immune compromised from organ transplantation, obesity, serious heart conditions such as heart failure, coronary artery disease, or cardiomyopathy, sickle cell disease, and type 2 diabetes. Now, this list is a list of persons who might be considered high risk, and there's continued and active studies of these individuals in these areas. Remember, this is a novel virus for the human race, and so it does take a while to understand this information and understand who's at risk and who isn't. So we might see these lists change as time goes on. We might see more diseases added on, but this is what information we have right now. So a moderate to severe asthmatic. So moderate to severe asthma would be an asthmatic who most likely is on some type of controller medication, such as an inhaled corticosteroid used every day. Cerebrovascular disease, cystic fibrosis, hypertension or high blood pressure, an immune compromised state, whether it's immune compromised state from illness or whether immune compromised state from being on an immune compromising agent, such as a steroid or a biologic. Neurologic conditions like dementia, liver disease, pregnancy has been recently added to the list, pulmonary fibrosis, smoking, thalassemia, and type 1 diabetes. So now we're going to go on to another scenario. My child tested positive for COVID and had no symptoms. So what do I do in that scenario, right? So what's recommended by the CDC is to stay home isolated in a quote unquote sick room if possible. So isolation in a sick room is much more isolated than the previous scenario that we had, because when we say isolated sick room, we literally mean a room where that child stays, and maybe if there's a possibility for that child to have a private bathroom that they can go to. And if that child has to come out for whatever reason, there should be ultimate protection, like with a face mask and social distancing if they have to come out of that area. Now, clearly, you guys are parents. And as parents, many of you are parents to small children. So in reality, you can't isolate a small child to a sick room. You have to care for your children. This maybe is more relevant to older children, such as teenagers. So if you are in a situation where your child tested positive for COVID and had no symptoms and does need to be isolated, then most likely that means you also then need to remain isolated with your child. You may leave isolation as long as there continues to be no symptoms and 10 days have passed since the test, and now this second scenario is a little bit more difficult because of the availability of testing, or there have been 2 negative COVID-19 tests at least 24 hours apart. Another scenario, my child has known COVID-19 with symptoms or has COVID-19 symptoms but has not been tested. So in that situation, once again, your child should remain isolated in a sick room if possible. I think we already discussed the consequence and what that means if you have smaller children. Your child may leave isolation after 3 days with no fever. So fever has to be better for at least 72 hours. Respiratory symptoms have to be improved, and 10 days has to have elapsed since the symptoms first appeared. Now, alternately, they may leave isolation if fever is also resolved and symptoms are also better, and there are 2 negative COVID tests at least 24 hours apart. So there's your alternate scenario. So clearly, the next obvious question is really, well, when should my child be tested for COVID? So in general, I think this is a bigger question about when doctors do tests or when providers do tests. So generally speaking, providers do and order medical tests when the results of a medical test will be used in diagnosis and to make changes in treatment or to make changes in patient behavior as well. Now, due to the increase in COVID-19 positivity that we're seeing really nationwide, but even in particular in our community right now in Duval County, many more people naturally have been wanting to be tested, and test results can take a long time. There's a problem with availability of test results as well. Some test results can take up to 10 days to get back. And we also know that since currently there is no effective treatment for non-hospitalized patients with COVID-19, testing should be performed on children who meet these criteria. And these criteria are criteria that we as physicians at Carithers Group have really decided these are great scenarios to consider testing. So the first one is, my child has a COVID-19 exposure with no symptoms that require hospitalization. With symptoms that require hospitalization. So obviously that would be a scenario where that child should get a COVID test. So the second scenario, COVID-19 exposure, my child's had a COVID-19 exposure and has no symptoms, but for whatever reason, and it might be because of your employment or for whatever reason, you can't do the 14-day quarantine at home that is asked of you by the CDC. In that situation, that might be a situation you consider getting your child COVID tested. COVID-19 exposure is another situation where your child may be exposed and has symptoms that are COVID-related symptoms for 3 or more days, but that child cannot isolate for the 10 days since the onset of symptoms. Once again, for whatever personal reason you have, that's a scenario you might consider testing. If your child has had a COVID exposure with symptoms for 3 or more days and those symptoms are getting worse, particularly the respiratory symptoms, that is clearly a reason, if your child's respiratory symptoms are getting worse, that you should seek medical care. Your child should get seen. And very likely, as you seek medical care, your child will receive a COVID test. And then lastly, it is required now prior to surgery, and actually prior to any surgery for children, that they need to have a negative COVID test. And that's really because of the risk to the operating room personnel, because when you do a surgery and when you do airway control and airway management of a patient, that could potentially spread the virus through the entire operating room. So where do you get tested? Well, at Carithers Group, we are doing tests, but we only have a limited number of tests that we can do. So thus, we have to limit it to children who are symptomatic, that we're seeing that are sick, as part of an evaluation process. And those are decided really patient by patient. We do not have the ability right now to just test all kids or test asymptomatic kids. We are constantly working this avenue to try to determine ways that we can increase our testing ability. But there are some additional testing sites, and I've left that link on this page, which you can refer to. And those sites are all pediatric testing sites. Now, when should my child with known or suspected COVID, so I know my child has COVID or my child is exhibiting COVID symptoms, but we haven't gotten a test. When should I seek emergency medical attention? Well, here's some really obvious reasons that I think are important to know. So number one, if your child is having trouble breathing, that should be a great reason to seek medical attention. If your child is having persistent pain or pressure in the chest, if there's new confusion, if there's inability to awaken your child or inability for your child to stay awake, if your child's having color changes of the lips and face that are blue, that's a concern. And then if there's any symptom that is severe or concerning to you, then in those situations, clearly you should seek medical attention. But please, if you seek medical attention, it would be very prudent and very wise of you to go ahead and, if you're calling 911 or if you're going to the ER, notify the people that are going to be contacting you and your family that you think your child might have COVID. That way they can take proper precautions as they're approaching you and your family. Well, I really appreciate you listening. I hope that this was helpful. Please, once again, realize that this information is current as of right now, and it might change. We're going to do the best we can to keep you guys updated. And please stay safe. Please be careful. And we'll all get through this together. Thank you.